I have seen a number of violent events in my line of work in my career that have definitely been traumatizing.
Maddie Beaumont has been a nurse since 2015 and says she's experienced and seen her share of violence at work.
People can get punched in the face in the ER and that kind of stuff. So it happens. Violence is very real. I don't really know a nurse that hasn't experienced some sort of verbal attack in their career.
WorkSafe BC says there's been a 25% increase in acts of violence in the workplace over the last 5 years, with over 2,800 claims in 2022. Beaumont says she's not surprised.
I would like to look more at it from like a systemic perspective. You know, people are getting angry because let's say that they're not seen quick enough in the ER, right? And then so they decide, you know, they berate somebody.
WorkSafe BC says workers and employers need to start talking about violence, particularly in healthcare, hospitality, and retail.
Almost a culture of normalization out there, you know, healthcare leaders that believe violence is a part of nurses' job. And I certainly think this is not true.
This UBC nursing professor says when nurses don't have the time to adequately meet the needs of patients, this can escalate aggression.
They're not security personnel. They do not receive training on physically intervening or responding to violence.
In a statement to City News, the BC Nurses Union says in the last decade, 40% of all injury claims were from violent incidents, and more than 85% of those affected were women. And to address the violence in healthcare settings, it welcomes the government's recent plans to hire 320 protection service officers in 26 healthcare settings.
There's a way larger problem.
But Beaumont says staffing is the problem.
Why are the wait times so long? You know, why are we short-staffed? Like, where are the incentives for bettering everybody's experience? I think that we could definitely address some violence by much broader systemic interventions.
She says she understands why patients are frustrated.
How could your emotions not run high in those situations when you're worried about a child or you're worried about a loved one or you are sick and you are having to deal with the problems of the systemic problems of our healthcare system.
In Vancouver, Angela Bauer, City News.